so much. I really appreciate the invitation. This is a very shortened version of a longer talk. If you would like me to send a link to the longer talk, which is about 45 minutes, you can send me an email. This is my email. I will put in the chat after, but we'll be talking about the remarkable impact of a ketogenic diet on brain health. And quickly, we will talk about what are ketones, the positive effect of that diet on brain metabolism, the evidence review, of course, a brief, but some of the integral papers, and implementing ketogenics into yours and your patients' lives. And the ketogenic diet, for those of you who are not familiar with it, it is a very high-fat, low carbohydrate, and moderate protein diet. I have the comparison of the ketogenic diet and the comparison with the standard American diet. And you can see the big difference in that it's very fat heavy. It forces the body and the brain to use fat versus carbohydrates as a primary energy source. And it mimics the fasting state where apoptosis and mitochondrial growth occur. And by mimicking the fasting state, and it is evolutionary. It is the way we as humans were designed essentially to use energy. The fed state is nutrients are stored. Glucose is the primary energy source, and this leads to insulin resistance. And insulin resistance in that inflammatory state is essentially thought to be the cause of many of the chronic inflammatory conditions, especially diabetes, which this disease is very well known for, but especially in mental health and neurodegenerative diseases. When fat becomes your primary energy source and you go outside of the standard glucose metabolism, you don't have insulin dysregulation. Without insulin dysregulation, you have no insulin resistance, and you decrease significantly the body's inflammatory state. Now, ketone bodies themselves, there's three of them. There's acetone, 3-beta hydroxybutyrate, and acetoacetate. These are your primary fuel in the absence of carbohydrates. And the really lovely thing about ketones is they are rapidly transported to the blood-brain barrier versus other types of energy. And that's one of the reasons that this type of energy is so specifically helpful for processes of the central nervous system. And in ketone metabolism, very simply, the liver converts fatty acids into ketone bodies. There is oxidation and utilization of the ketone bodies by mitochondria, our powerhouse of the cell, my favorite organelle. And it's especially useful in organs with high energy demand. It produces NADH and FADH for electronic transports, which delivers that acetyl-CoA for energy production. Glucose is not part of this. It is a widely stated lie that you need glucose for energy metabolism. You absolutely do not. This is the fasted evolutionary state that kept us going for millennia before the introduction of Lay's potato chip and Cokes and Diet Cokes. So keto diets will induce brain fasting physiology. I like this diagram. It looks at how it impacts brain health specifically. Remember, these ketone bodies fuel the brain through the blood-brain barrier. And I love the fact that it really improves BDNF, brain-derived natriuretic formula proteins, because it really helps neuroplasticity and brain connectivity. It helps induce healing of the brain so you can have long-term existing disease, and implementation of a ketogenic diet rapidly will help decrease the symptoms. Once again, kind of briefly looking at the high carb versus high fat diet. Don't want to do too much because we're in a time crunch. But the main points are high glycogen, which is caused when you have a high insulin state and lots of glucose, causes insulin resistance, hyperglycemia, inflammation, and metabolic syndromes. Ketones are used for energy, cell growth, mitochondrial growth, neurotransmitter activation, decreasing your inflammation so there is no insulin resistance. It's a renaissance of a very, very old concept. Back in about 460, 461 BCE, Hippocrates was first cited as using this for patients who were having fits, or as we know them now to be seizures. In 1921, the Mayo Clinic did publish for the first time on a ketogenic diet for epilepsy management, and their studies were remarkable, and they showed that if they could keep patients on this diet, it was 50% seizure-free for patients who had no other options. 35% additional patients had some improvement in their seizures, often dramatic, but still had a few. Considering there were no other ways of managing seizures at this time, that was certainly remarkable. But yet it fell out of favor. Why? Well, as pharmaceuticals developed, a sort of more natural thing that can't be marketed or regulated fell out of favor. But yet even today, on these seizure medications, anti-epileptic medications, who are very good, but have an incredibly large side effect profile, and 30% don't even respond to the medications in even multiple combinations. There was a Cochrane review, a little bit older, very interesting though, looking at 427 subjects. 55% of them, no matter how long their seizure history had been and how many meds had been on, were seizure-free at 3 months, 55%. 85% had greater than 50% reduction in their overall seizures. It kind of mimics back in the time of Hippocrates in the Mayo Clinic, but yet only after 1 year, 55% had essentially left the diet. They were not compliant. Why? It is challenging. My bias here, I follow ketogenic diet. I do not find it challenging because I find the health benefits so incredible that it's motivating, but it can be a challenge for some people, and that is the biggest downside to keto compliance. When we look at specifically brain health, and again, I could literally go on for days about the effects on all the body systems, but we're focusing on brain health. The model, the biopsychosocial model of health, looks at a predisposing, a precipitating, and a perpetuating factor. Those are the three things that induce illness. And we know that decades of research demonstrate remarkable brain health impacts. What are the mechanisms of action? Briefly, it decreases your inflammatory markers, including your reactive oxygen species. It fixes the glucose insulin concentrations and insulin resistance. It takes away insulin resistance. It helps decrease amyloid plaques, although obviously we do know the new research in brain function and that with dementia seems to decrease the impacts of amyloid plaques. But it also decreases the chronically inappropriately activation of the microglia. The brain isn't overstimulated, which cuts down on inflammation, my recurring theme. It increases the repair of neuron myelin sheaths. And so one of the biggest things with keto, and I just feel I must touch upon this, is the demonization of cholesterol. Well, every cell in our body, and specifically our neurons, requires cholesterol to build our cell and our cell walls. It coats our neurons. It makes our neurons connect and talk to each other. It is the first thing a mother feeds their child. It is not a toxic substance, and it has been implicated in so many disease processes that by adding statin medication, and again, it's very science-based, we take away the cholesterol, and by taking away the cholesterol, we make the neurons less functional. Ketogenic diet adds that cholesterol back in. It helps increase production and regeneration of the mitochondria and improves the efficiency of their metabolism. It improves autophagy. It helps the cells recognize it's time to go. Let's bring out the new cells. It helps the gene expression modulation for those new cells. And very specifically, it also helps convert glutamate to glutamine and glutamine to GABA, helping with the imbalances that have been implicated in neurodegenerative disease and schizophrenia, bipolar, and many of the mental health processes. How do we put this information together? And it can be a little challenging, but how do we put it together? Well, we know that there are metabolic disturbances across all mental health and neurodegenerative disorders, and that is impaired glucose metabolism, impaired cortisol metabolism, mitochondrial dysfunction, and increased inflammatory and reactive oxygenation species. Ketogenic diet has positive effects on many medical illnesses. In fact, I cannot think in my research that I have done over the past year of really hitting down and investigating this hard since it changed my life personally. There isn't a disease out there. There isn't an organ system that a ketogenic diet has not been shown in either a small study, a case study, or a large study to have a positive impact. I want to focus specifically on using diabetes because this translates right to brain health. The question of why do diabetics have poor brain health? Let's think about it a different way. Why are so many people with poor brain health diabetic? Well, it's because diabetes and neurodegeneration are interconnected. Chronically high glucose levels leads to insulin resistance, and insulin resistance decreases insulin CNS effects. If you have brain insulin resistance, that affects the neuroprotectiveness and acetylcholine synthesis. Well, guess what? If you have high insulin resistance and decreased neuroproductivity, that increases your cognitive decline and dementia. An incredibly simple model that's very easy to understand why this diet specifically impacts brain health. In fact, diabetes type 3 is another term for Alzheimer's disease. It is brain insulin resistance, and the new definition is brain glucose dysregulation directly correlating with those plaques, tangles, and dementia clinical symptoms. I want you to focus on the center column here. 81% of Alzheimer's patients have type 2 diabetes. It doesn't scream coincidence, does it? Type 2 diabetes, we know, increases the risk of Alzheimer's in general, dementia, and mild cognitive impairment by 1.5 times. And the risk of Parkinson's is increased 2.2 times in diabetics versus non-diabetics. And interestingly enough, 28% of patients with severe mental illness have diabetes compared to 12% of the general population. Incredibly impressive statistics. We call it the metabolic mindset, the mental and metabolic mindset, in that all mental illness patients, interestingly enough, and sadly enough, have a shorter average life expectancy than their cohorts. A decade shorter lifespan in men and 7 years in women. We've lost a decade with these patients. The cohort adjusted age death rate is 67 to 47, all comers. And this data does imply a mechanism other than the CNS disease itself. And the mortality is primarily secondary to cardiovascular and neurovascular diseases and cancers. Because remember, with those inflammatory markers that are increasing, everything else increases. That increased cellular inflammation causes mitochondrial and cell dysfunction. When we look at all-cause mortality, decreasing cellular inflammation will decrease all-cause mortality and morbidity. Hundreds, if not thousands of studies have touched upon this. And one of the things specifically that is a new type of research, not specifically to brain health, but looking at the role of a ketogenic diet in mTOR. And mTOR regulation, if you know anything about that particular marker, it is what helps cancer turn on its gene expression. Once again, you don't feed something sugar and increase the insulin resistance, you don't get the secondary process. These are the main 7 inflammatory markers that ketogenics affects. But the biggest thing, again, to me, is the effect on mitochondria, the powerhouse of our cell. Again, I have like double the amount of slides. If you email me, I'll send you my entire slide deck and we can talk ad nauseum about this. But I want you to think about this as a naturally antioxidative and anti-inflammatory cell. It's an organelle in the cell, and it decreases your mental illness, your brain inflammation, your neurodegenerative diseases, and increases your neuroplasticity. Strong body does equal a strong mind. Hippocrates was on it. He knew what to do with seizures. He knew what to do with your body. There have been compelling evidence for decades that a low carbohydrate diet directly and indirectly improves neurovascular disorders and mental illness, because keep in mind, it is a CNS disorder. Mainstream science is catching up. You'll see all over mainstream science what used to be, as some people delightfully call the woo-woo science here in the US, we call it the woo-woo science, not so much anymore. It's backed by very, very good evidence-based studies, 2 of which are here. These were groundbreaking. They came out within the last year. And they showed if you take a patient with serious mental illness and metabolic abnormalities, we are talking inpatient mental illness patients, you put them on a ketogenic diet. One of these studies put them on for 60 days, one for 4 months, with very limited intervention otherwise. Transition them off their medications very quickly, both their metabolic medications, diabetes, etc., and also their mental health medications. And of these patients, I want you to focus on the top study, the Stanford study with 21 participants. So yes, small, but look at the outcome. Nearly 80% had a clinically meaningful psychiatric improvement, and these were inpatient psychiatric patients. These were not people who were functional in society. 100%, 100% reversal of metabolic syndrome. 4 months, 4 months on this diet. 10% weight loss, of course, it makes sense. And they had an adherence trends. People say, oh, these people can't stay on a diet because they have mental illness. Well, guess what? Their feedback, their positive feedback was so good that their compliance actually skyrocketed. There's a ton of research going on. There's residential programs. There are not just what I mean for residents for training, but inpatient programs where people live in a house together, learn how to cook, learn how to eat, and have a social support to get off their mental health medications, improve their metabolic syndromes, and improve their overall physical and mental health. How do you start? Well, it's actually quite easy. You have a medical professional. Wherever you are, you find a medical professional, an internist, a family practitioner. On the program today, there have been physicians and researchers from all across the spectrum. You find a medical practitioner that knows about ketogenics and can help. You find a dietary counselor, a nutritionist, a coach, someone who's familiar with ketogenics. Read the literature. Anyone can read medical literature. You can be a citizen scientist. You don't have to be a physician. Anyone can read medical literature. And then cleaning and shopping. Clean out your house, because if you have snacks there, you're going to eat your snacks. It doesn't matter how good you feel. Clean out the house, and that 100% helps. Reminder on the ketogenic diet, it's high fat, low carb, and moderate protein. And one of the things that's really helpful at initiation, and I use myself actually every day, is exogenous ketones to help transition you very quickly into a ketogenic state. It wakes your brain up. In fact, I have to be careful about my ketone levels and exogenous ketone levels, because if they're high, I can't sleep. And I'm a night shift doc, so I need to sleep. So I have to actually pull back on my ketogenics occasionally, because it works too well to wake up that mind. These are the Hateful 8. There's a whole different bunch of Hateful 8. Here's the thing. It's quite simple. If you can't pronounce it, don't eat it. If it's artificial, don't eat it. If it's processed, don't eat it. If, we have a very different state of affairs in the US about our food sources than they do in Europe. And the artificial ingredient list here is pretty profound. But generally, if you have to pull it out of a package and read the back, you should not be eating it. General rule of thumb. And listen, I'm not the one to tell you about seed oils. We all know how horrible they are. We had talked about adherence. It is definitely one of the biggest difficulties. And to this day, about 38% of adults would prefer to be on a drug lifelong than a lifestyle change. There is absolutely a role for medications. I don't want people to think I'm anti-medication at all, but no one wants to be on a drug for life. And rather than fund a sick care system, we should worry about a healthcare system and actually worry about the health of our patients and learning how to cope with their mental illness and their metabolic illness. A multidisciplinary compliance approach is necessary for that. And the speaker from England touched upon that, or the UK touched upon that, and I wholeheartedly agree. There are very few adverse effects. The biggest one, the first couple of weeks, some people get what's called the keto flu. Essentially, you're withdrawing from a toxin. Sugar acts on the nucleus accumbens of the brain. It's the same area that cocaine acts in. It's an addictive substance. You have a withdrawal from it. And the biggest thing is constipation. Believe it or not, even with all that fat, people do get constipated. These things do, as they do, work themselves out in a way. Many additional references, there's probably 100 more. I highly encourage anyone who's listening to open anything by Dr. Georgia Ede or Dr. Chris Palmer. They are fantastic. They write science for the average person as well as for the researcher and physician. And in summary today, thank you so much for the World Obesity Conference for inviting me. And by mimicking our evolutionary protective fasting metabolic state, our diet of ketogenics decreases cellular inflammation, insulin resistance, and multi-organ disease development and progression. The ketogenic brain health and metabolic mind research shows astonishing positive effects on mental illness and neurodegenerative diseases, along with other medical illnesses, and compliance is certainly the biggest challenge. But the reward is a long, healthy, drug-free life with a very sharp intellect. Here, as the kids say, are my socials. Please do not hesitate to reach out. You can email me. I'm on LinkedIn. I'm more than happy to send you a much larger slide deck. And if you have any questions that we can't answer here because of time, please don't ever hesitate to reach out. Thank you so much.